don't know you. Um, would you mind going all the way back to you just being a medical doctor and your wife getting sick and how you discovered nutrition? Would you give everybody the basis of how you got started? And then it's just going to let you run with it.
How much time do I have, Todd? That's what I
Yeah,
need.
30 minutes exactly.
Okay. Well, let's start at the beginning. I'm a traditional physician. I was trained at the University of Colorado Medical School. I learned to be a traditional doctor. That's why I practiced for the first 25 years of my medical practice. I was, I always wanted to be a healthcare expert. And when you get an MD behind your name, everybody looks at you that you know everything. Nothing could be further from the truth, as I've learned over time. But my patients thought I was the expert in every health question they could bring up, whether it was supplements or diet or, lifestyle, everything. And but what I found is that I was taught in medical school that supplements really did nothing except create expensive urine. And that was what I was taught, and that's what I trained or told my patients. That's basically where I was, and I was pretty strong about it. I did quite a bit of arguing to get my patients to quit taking supplements altogether. But I knew my drugs, I knew disease, I knew how to treat disease. I was actually pretty good at it, and I was a family physician. I did OB for 21 years. I scrubbed in surgeries. Was your typical family physician back then. We did everything and they had a pretty large hospital practice, all of that. And that's just the way I was. I didn't know any different because that was not my training. We didn't learn anything in medical school about nutritional supplements and very little about eating a healthy diet. I bet you I probably had an hour lecture in all the years I was there, and I was supposed to be an expert about it. But anyway, my life changed because of my wife, and that's my conversion story. My wife, we've been married now 42 years, and when we married first, she had a disease called chronic fatigue fibromyalgia, and many of you may understand that. And that's what I lived with. She thought when she married a physician that her health was going to get better. Nothing could have been further from the truth. Every year she went downhill, got worse, got worse. She's a horse trainer. That's what she does, and she ended up in 1995. This is where my story really begins. She came down with a very serious pneumonia. And even though we were able to get her through that pneumonia, uh, she ended up in a very chronic fatigue state. She couldn't get out of bed, maybe for a total of an hour per day. I actually had to have one of my children stay home with her each day to take care of her so I could go to work. And this went on month after month after month, in spite of seeing 4 different medical specialists who prescribed between them 9 medications. And she did not get better. And after about 4 or 5 months, I kept asking these specialists, well, is my wife going to get better? When? All these, just very frustrated. And they said, well, we don't know if she'll get better ever. It may take 6 months, may take a year. They just didn't know. Well, it was at that time a neighbor came over to my wife and said, my husband had a pneumonia and he had this. He was really fatigued, took these supplements and got better. And she left them with my wife. Of course, my wife knew how I felt about nutritional supplements. And when I came home that day after work, she asked me, could I start taking these? And I was even surprised at my answer. I said, well, sure, honey, we're not doing anything. Try anything. And so she started taking some high quality nutritional supplements. And I didn't know that at the time, but that was fine. But within 3 days, I could see a difference. And within 3 weeks, she was off most of her medication. In 3 months, she was better than she'd been in 10 years. Now, for me, that was either a miracle of the Lord or my worst fear was due because of supplements that I've been telling my patients all these years did absolutely nothing. And so that's kind of where I was in a dilemma. I knew nothing about supplements. We didn't learn it. Pharmaceutical reps came into my office, all, 5, 10 a day, tell me about the drugs and this. No one ever told me about the health benefits of vitamin E or vitamin C or vitamin D. No, I had to learn this. So I started to do my own research. And that's what I've been doing for the last 25 years, is trying to, do the medical research in the medical literature. It's there, studies that show that if you take high quality, complete and balanced nutritional supplements, there's a health benefit. So I've always been a believer in a healthy diet. I've always been a believer in modest exercise. I'm a real big fan of Dr. Kenneth Cooper, who coined the term aerobics back in the early 70s, got the exercise craze going. And in fact, that was one of the first books I got to, was The Antioxidant Revolution, written by Kenneth Cooper. And he started promoting and teaching me, and that's where I've gone. And so that has led to the writing of my books. That's it. I just sharing that knowledge and everything. But you start to realize that it became a triad of healthy lifestyles that I began strongly promoting in my practice, which, along with a healthy diet and exercise, we need to be taking nutritional supplements each and every day. And it's not about disease; it's about health. Yeah, my wife improved her health, and this was wonderful, and I saw it. But then I started seeing that same thing happen with my patients, and I had some amazing results I'd never seen in my medical practice. And, because of FDA guidelines and everything, I can't share a lot. I never use the C word. I never cured anybody of anything. My wife still has fibromyalgia, chronic fatigue, but she's learned to do it. She's improved year after year after year. And since we have been part of Partner Co. and these nutritionals, she's even made a level higher than she's ever been. She rides a couple horses a day. She's aggressive. She does this, and she feels, when she was 40, she felt like she was 70, and now she's around 70. She feels like she's 40. And it's been a wonderful time. And so what I've learned is that I have now become that healthcare expert I've always wanted to be. Before, early in my career, the traditional doctor, I was a disease care expert. And that, you got to understand that I was a disease care expert. I knew disease. I knew my drugs. That's where we're trained. In fact, I helped some residents come out. We have a family practice residency here in Rapid City, South Dakota, where I practice. And they come in, and their instructors are telling them, well, if you don't write a prescription, then you haven't earned your office visit. And I'm going, are you kidding me? This is the way medicine is, and you know that. Doctors love their drugs. Boy, I'll tell you, they just can't write them quick enough. But I want to share with you today, because I'll be talking to those that come to Panama City. I'm very excited about this because, I've had, Todd and I have a long-term relationship, and Kenny, and everybody down there. We just really have had it. It's just been fun. And I'm excited about coming down. We got some exciting things planned. I'm going to educate you for an hour. So I'd like to be more philosophic today and just teach you some things that I think you need to hear from a physician, is because my whole life has changed. And I think medicine's changing. But all the time, we have felt that anybody who comes into our practice, the medical community, actually even the drug companies, all of everybody involved in medicine really recommends or encourages physicians to give their patients a trial of healthy lifestyles before they prescribe their drugs. I call this, and everybody calls it, first step therapy to treatment. So in those patients who come in with that early high blood pressure, elevated cholesterol, early diabetes, maybe even early heart disease, elevated, all of that, we should be giving them a trial of healthy lifestyles before we prescribe medication. And in fact, the next time you're watching TV and you see a statin drug, Lipitor, Crestor, Zocor, being advertised on TV, listen very carefully. Because what they do is they say, when diet and exercise have failed, then you try our drugs. Why is that? Well, that's the way the FDA approved these statin drugs. What they found is that It's second step therapy. It's not to be first step therapy. But see, physicians, they just ignore this recommendation or this, all of this. And why do they do that? Well, when I talk to my peers and I talk to them why they don't recommend nutritional supplements and lifestyles and anything, they say, well, or healthy lifestyles, let's put it that, because most of them don't believe in supplements anyway. They say, well, number one, I don't think my patients would make those changes. And even if they did, they wouldn't be clinically effective. Those are two reasons. So why don't I just write the drug and skip all that? And that's what most people do. They can't get out their prescription pack quick enough. And that's where we are today. But when I started, I started to realize we should be using, yes, I use some prescribed medication, but I use it as a last choice, not a first resort. And I give my patients, at least when I show them, hey, you got early diabetes, you got prediabetes, you got, elevated cholesterol, you know, you even got early heart disease. I always say, I'll give you a trial of healthy lifestyles, which is diet, exercise, and supplementation. And I explain it to them, or I can just be a traditional doctor and write you a script. It's interesting, about 80% of my patients go ahead and actually go ahead and have me say, Dr. Strand, I would do anything. I'd do anything to avoid taking drugs. And I get about 20% say, oh, doc, I'm not going to do that. Just write the script. So that's my qualification in my medical office. And that's what I've done. But it's amazing to me how many people want to avoid medication. And so I call this first step therapy. But what you don't realize, and this is what I'll explain in Panama City, is that's what you're doing with the skinny drops. Okay, I'm just going to tell you, that's it. What are you doing? Well, you're trying to grab people. Yeah, they come in and their incentive might be, I want to lose weight. But see, I'm going to show you, and we'll talk a little bit about where all this is and what's really behind transformation, is the fact that people, because of poor lifestyles, over the years become less sensitive to their own insulin. And it's really inactivity and the all-American diet. And we'll get into that, and when I'm speaking in Panama. But what happens is over time, you just become less and less sensitive to your own insulin. And finally, you tip over into an abnormal metabolic state that we now call prediabetes. It used to be called the metabolic syndrome or insulin resistance syndrome, sometimes syndrome X. But that is an abnormal metabolic state brought on by poor lifestyles. But the body responds to this by actually making more insulin. So you see blood insulin levels going up. And then a constellation of problems occur. Your blood pressure goes up, the cholesterol goes up, but mainly the triglyceride, the other fat in the blood goes up. That good HDL cholesterol goes down. And you start gaining this unusual amount of weight around your middle. And so central weight gain. Well, what people don't realize is when you're in this state, you can't utilize calories normally. That's why we gain weight. See, insulin's job is to transport glucose into the cell to be utilized primarily as energy or stored as glycogen or fat. Well, what happens is that we become less sensitive to insulin, and especially our muscle. So the first thing that becomes not sensitive to insulin, is the muscle. So it can't get the calories it normally used to burn as energy. So now many of the calories are now diverted to the fat cells of the abdomen. And insulin job is to convert that glucose to fat and then block the release of that fat. And so we call insulin our storage hormone. That's what it is. And here we got it super high. Everybody that's walking around that's tipped over into this abnormal metabolic state, a calorie is no longer a calorie. So what we're talking about is going against the mantra of the weight loss industry for the last half century or longer. Calories in must be less than calories out, or you can't lose weight. But when you're in this state, it just doesn't matter. You can't utilize calories normal. And this is why I learned back in the 90s that I started a program this whole program, Healthy for Life, in 1996, 97 in my medical practice. And what I found is that all these patients couldn't lose weight if they tried this diet, that diet, whatever. It didn't matter what diet they were on. If they did lose some weight, they quickly gained it back. 98% of diets fail over a year or two, and everybody says, well, I kept it off for 1 or 2 years. Well, no, you just took you a year or two to gain it back, when you lose weight. So weight loss isn't the issue. It's keeping it off. And that's but what happens when you're in this state, you hold on to fat like a sponge holds on to water. You just can't lose weight. And so Partner Co., when it started to develop and wanted to develop a weight loss program, they wanted to take the science and evidence that I share and I've written about in my books. And what it is that it's just a very simple principle. Since it's poor lifestyles that got us into all this trouble, I went and researched the medical literature with a simple philosophy. Well, then maybe healthy lifestyles that actually improve insulin sensitivity can get us out of it. Very simple. So I studied the medical literature and I found a triad of healthy lifestyles that really helped. Number one, eating a diet that did not spike your blood pressure, combining those good carbohydrates, the good fats, the good proteins. I don't believe in eliminating carbohydrates or eliminating fat or we need them all. The body needs it, but they're healthy fats, they're healthy proteins, and they're healthy carbohydrates. You learn to eat that. And that's what the slenderized diet, when you see the booklet, that's what's there. That does not spike your blood sugar. The second thing is if you just do modest exercise, you don't have to be a marathon runner or triathlete. All you do is need to maybe just get the body moving. Aerobic activity really improves insulin sensitivity from a different mechanism of eating a healthy diet. And so simply walking briskly, 30 minutes, 5 days a week. You need some days to rest, but 5 days a week. Or maybe it's tennis or biking or hiking, swimming. It doesn't matter, just anything that gets the body moving significantly improves insulin sensitivity from a different mechanism. Well, then you study the medical literature, and of course, they study nutrients separately. They don't put them together. So they'll do a study on vitamin E. They'll do one on vitamin C, one on chromium, one on magnesium, and vitamin D. That's how they do studies. They study nutrients like they do drugs. But vitamin E is not a drug. Vitamin C is not a drug. These are nutrients we get from our foods, but because we can now supplement our diet, we can get these nutrients at levels you can't obtain from your food. And all these studies show a health benefit, even using one nutrient at a time. But when you combine them, and this is the other thing, you get a synergistic effect and significantly improve insulin sensitivity from a different mechanism. And this is what I taught for 16 years. We did 3 clinical trials using this. This is what we found. And we had great success, actually, improving insulin sensitivity to allow people to tip back into a normal metabolic state. And the reason we know that is those blood insulin levels that went up when they became less sensitive actually went down. Every clinical trial showed we dropped insulin levels 50%. We got them back down to normal and allowed people to tip back into a normal activity so they could utilize calories normally. And so once they did that, they started losing weight. And so we didn't count calories, we didn't count grams of fat or carbs, we didn't uh, weigh food, all of that stuff. And I'm not a real fan of scales. I think scales are not a motivator. If it is, then somewhere down the line, you're not going to lose as much weight as you think you should, or you end up gaining weight and this doesn't work for me, and you walk away. I promote healthy lifestyles that happen to have a side effect of permanent fat loss, and that's what we're doing. But it worked, and it was wonderful, and I saw wonderful results. Well, then about 2011, I was introduced to SlenderX and these homeopathics. And obviously, I'm a physician. I know my drugs. I'm not a homeopathic physician. But I started using these in my practice, and I realized that that it actually improved insulin sensitivity. It has 10 different ingredients, the Slenderx, and 6 of them improve, they say, fat loss, but I see, because I do the blood work, I see improvement in the insulin sensitivity. There's a couple drugs that improve metabolic performance and a couple that suppress appetite. So it's a combination and it's effective. But what I found is I had great results when I had diet, exercise, and supplementation. But when I started at SlenderX, all these results occurred about twice as fast. I could get the same results more quicker. It just happened about in half the time. Well, people like to have things happen fast. Plus, the accelerate helps, the anxiety gives them gives them more, plus more energy with a strong B vitamins, biotin, and the Ayurvedic herbs, ashwagandha and rhodiola, all of this. So it's a great combination. So what I'm learning now, and just here's a very key thing. If I got my patients to make one of these lifestyle changes, I saw some improvement. It didn't matter which one it was. If I saw them do 2 of the 3, I saw a little bit more improvement. But if they did all 3, diet, exercise, and supplementation, the results were simply phenomenal. I mean, it blew my socks off. This is why I've gotten so excited. And when you do this, not only do you lose weight, but you have more energy, more focus, you feel better. Quality of life comes back. See, my patients aren't as concerned anymore about the years in their life as they are the quality of life in those years. And this is where we're going and what you're doing. You are doing first step therapy. Every person you put on the SlenderX drop, and we start to work with them and teach them healthy lifestyles. And, Carrie Hicks, is going to be speaking there too. Just their program, Steve Tiglis, what they're doing is wonderful. You come alongside these people. See, physicians don't have time. And even though the diabetes specialists in the world are saying, we need to be treating this pre-diabetes as aggressively as we do diabetes. Because by the time when you tip over, your arteries are actually aging a third faster than they should. You're accelerating your aging of your arteries, and the risk of stroke and heart attack and then eventually diabetes is tremendous. But by the time the blood sugars start to go up, because what will happen over time is the body can't keep making that level of insulin, and it will finally drop off after 12, 15 years. And then whoops, there goes that blood sugar shooting up. And then I, as a physician, diagnose you've got diabetes. And that's the way it's been. And so where we stand is the day I diagnose someone with diabetes in my medical practice, 60% already have major cardiovascular disease. I mean, this is why 80% of our diabetic patients are dying prematurely of a cardiovascular event, a heart attack, a stroke, ruptured aneurysm, peripheral vascular problems for they have to have an ankle or foot or leg amputated. 80%. That was true in 1960, it's true in 1970, and it's true in 2024. We have not changed that one bit. And that's why there was a consensus opinion written by American College and Association of Endocrinologists, which are diabetes specialists, and said they looked at the worldwide medical literature just like I did, and just like PartnerCo has. And what they found is that the answer is not a drug. The answer is intensive lifestyle changes. Well, you go in and tell a physician that, I'm telling you, if they can't write a drug, they kind of go into a cold shake and they ignore it. And I've been there. I've been doing this 25 years now. And they ignore it. They don't have time. They're too busy, putting out fires and acute medicine, and they don't have time to prevent anything. So that's where you come in. You're an army of people that are in the health and wellness business. This is what you're in. Okay. And so what you need to understand is the fact that this is it. This is where you are. You're playing a role. Now, I'm not asking you to go to the doctors and do that, but you have friends. This is one-on-one business. That's, my wife says, if you're not face to face and looking eyeball to eyeball with your people, this is it. And I know the internet and all the social media, but that's what it boils down to. An interest in individuals who are coming, who are frustrated, who are dealing with health issues and want to improve. And you get them in there and you guide them and you come alongside them. That's what's key. You got to be an accountability partner or train or help. But when you do that, you are practicing more medicine in the health and wellness industry than most physicians because 90% we found in the clinical trials, 90% of the diabetes can and should be avoided. And even if they're diabetic, they stay with it longer. There's no problem. Everything I teach here can be done with the diabetics. Now, we're not talking about really improving. Well, we all improve clinically type 1 diabetics, but they don't have any insulin. It's a different game. We're talking about type 2 adult onset diabetes. But the pre-diabetes, that's where everybody's heading. And so you're helping them go. Now, when you get someone that comes up in stage, oh, I've lost 50 pounds, I've lost 70, I've lost 100, I've lost 30. It's wonderful. I mean, we see it. That's the transformation stories. But what else do they say? Gee, the doctor took me off my blood pressure medication. Oh, I'm all, you know, I'm doing, I'm doing wonderful. He's reduced my diabetes medicine. I don't do this or I got this. I mean, it's just one thing after the other because they've gotten so much better. And that's the transformation. That's why I get excited by it as a physician. You know, so many people are taking drugs they don't need if they just knew what to do. And that's what we're teaching you. And that's what I'll be doing in Panama City. I'm going to give you the science and that make it understandable to you. That's what I feel I'm an educator for you. And that's why, Todd, I'm excited about you giving me the time to go over this so you understand why taking nutritional supplements is just part of a healthy lifestyle. And it's something you do day in and day out the rest of your life. There are so many health benefits, and I'll explain that. But you're going to share this message of health, and people, you'll see it. And I'll explain why we see, all of these transformation stories and what's the science behind it. But here's the key. Weight loss is great, but keeping it off is priceless. And that's what you got to understand. And this is where we're going with all of this. Yes, we got to start simple. I like the skinny drops. They get excited, and it's something that no one else has it. It's out there. You've got something that people don't do, but it's not a magic bullet. They have to be doing the lifestyles with it because when they get done and they reach their health and weight goals, I take them off the Slender X and they stay healthy, but they need to still be taking supplements. And you've got this time period to work with them and educate them on the health benefits, or at least show them things. And as far as that goes, and that's what's exciting. And I'm there. I'm looking forward, Todd, to seeing everybody in Panama City. So I'm turning it back to you.
Yeah, so Dr. Strand, we are out of time, but I have one question that I say a lot, and I just want it confirmed from you. But elevated blood sugar could be called metabolic syndrome, then prediabetes, then type 2 diabetes. And a lot of the YouTube doctors that I follow say all-cause mortality outside of things like suicide or accidental death increased tenfold with any elevated blood sugar. But I heard you one time say 25-fold. So
Yep.
would you just give that
Yeah.
statement there that we can all say it accurately?
Gerald Ravens, actually, it's in between those. Gerald Ravens is the researcher from Stanford who actually identified back in the 1980s, in early 90s, this constellation of problems. He called it Syndrome X, especially metabolic syndrome, all of that. But his big thing was this increased your risk of cardiovascular disease 20-fold, much more. I'm not a strong believer that heart disease is a cholesterol. I believe it's a disease of inflammation in your artery. And just the way you eat foods, and when you tip over into this metabolic, it's pre-diabetes, let's put it, that's what we're calling it now, a lot of inflammation in your arteries. And this is the thing, 20-fold increased risk of having a heart attack or stroke. That's the authority in the world is Dr. Gerald Raven. So that's what I would use. And it's not just blood sugar. Think about it. It's all that. It's high blood pressure. It's elevated. It's called triglycerides going up and then HDL going down, blood sugars coming up, and all the things and the weight. Just the weight. That's why doctors refer to this as killer fat because of the constellation, the central weight gain. And we all know that. It's just we can't get rid of it unless you can improve insulin sensitivity.
Thank you, Dr. Strand. A lot of people are with us this morning at work with earphones in, so we try to be right on time, but we cannot wait to see you in Panama City, where you've got a full 90 minutes to really share your knowledge with all of us. And Dr. Strand has got a huge surprise, everybody. He has been shipping a surprise to our house about once a week, and my entire storage room is full of that surprise now. So we'll be bringing it there. We thank you so much, Dr. Strand, for your time this morning.
Thank you, Todd.
Let's open it up. Anthony, let everybody thank Dr.